Hi and welcome. My name is Julia and I'm going to deliver a presentation on the roles and responsibilities of the registered nurse. I will cover the recent changes and their impact on the roles and responsibilities of the registered nurse, the role of the Nursing and Midwifery Council in relation to nursing practice, the implications of the Code on Nursing Practice and the role of the registered nurse, the need for effective communication in a multidisciplinary healthcare setting, and the effectiveness of the multidisciplinary approach in a healthcare setting. The recent changes and the impact on the roles and responsibilities of the registered nurse. There are many changes that have impacted the role and responsibilities of the registered nurse over the years. Some of these are political, economic, social, technological and scientific, organisational changes, professionalisation and policies. I will talk about some changes from some of these. There are more nurses than any other professions within the NHS. Unlike many years ago, nursing is now a profession and there are laws, principles and standards to follow. The NMC Code 2015 is a set of standards that nurses must uphold in order to be registered and work as a nurse. The NMC ensures nurses are up to date with their knowledge and skills and are fit to work. Through this, nurses are more able to deliver safer care and meet the needs of the patients, and care is now more person-centred. In 2009, nurses became an all-degree profession. This meant that all student nurses are now educated in universities. To become a qualified nurse, you must do a degree at university for 3 years, and this still stands today. Nurses are now seen as their own profession and now have extensive medical knowledge and skills. Now that people are living longer, there are more medical needs. This also comes with rising cost. As more extensive training has become available over the recent years, nurses' responsibilities have changed and more demand became upon them. Nurses were trained in things that other professionals were doing, giving them more freedom to do other things. Nurses are now able to better meet the demand of public needs because of this. Through clinical guidelines, protocols and patient pathways, patients now know more and can question the nurse's decisions. This puts more pressure on nurses to make sure they have the right skills and knowledge when dealing with each patient. Nurses now need to admit to any mistakes made and face sanctions. This provides transparency and better patient outcomes and less mistakes. Knowledge and skills are regularly updated, making sure nurses are more competent. In 2011, the government put a 1% cap on the NHS pay rise. This then led to nurses leaving the profession over time and less people applying for the role. Because of a later campaign to get rid of the cap, in 2017 the government scrapped it. In 2012-13, 24,192 nurses left the NMC register, and in 2016-17 this increased to 35,363 leaving. The Modernisation Agency 2001 was launched to lead NHS improvements. Its role was to support modernisation of the NHS, which would improve patient outcomes and experiences of their care. Nurses was trained on a more specific area and their roles were matched to the skills they have. This gave them control over their practice, which also led to less mistakes, better patient care and job satisfaction. Because of technology, patients' health records are now electronic. Many changes have come with it. This allows nurses to document all care provided easier. This allows nurses to document all care provided easier, as well as retrieving other information that can help prioritise patient care. All information that has been entered into the system allows other professionals to see it, and even the patient themselves where necessary. Having this system has reduced mistakes from happening and accidental oversights. Technology has also improved test results, waiting times, and identifying illnesses, allowing nurses to do their job better and treat patients more quickly. The Nursing and Midwifery Council in relation to nursing practice. Now let's discuss the role of the NMC. The NMC stands for the Nursing and Midwifery Council. Once a student has finished a nursing degree at university, they must register with the NMC. This allows you to practice as a nurse. First, you will need to apply to the NMC. Then once you have received confirmation from them, you will need to pay and take a test. Revalidation came into practice in 2016. Nurses need to revalidate every 3 years. This is to help you reflect on your practice and see how you can develop and improve. Revalidation also gives assurance to patients and the public, knowing that nurses are up to date and fit to practice. To revalidate, you must have worked 450 hours over the 3 years, practice-related feedback, 35 hours of continuing professional development, written reflective account, reflective discussion, provide a health and character declaration, and have professional indemnity arrangement. The NMC came into being in 2002 and it regulates the nurses and midwives throughout the UK and nursing associates in England. They promote high education and professional standards for nurses and midwives. They make sure that nurses are up to date with the knowledge and skills and are working at professional standard. At the moment, they support more than 771,000 nurses. The NMC set professional standards and behaviour under the code that registered nurses must uphold. Nurses must also follow the professional duty of candour. This means nurses need to be open and honest with their patients when anything has gone wrong with their care. They must also let their colleagues, employer and organisations know and be cooperative to investigations and reviews. The nurse must inform the patient and apologise, offer a solution and support where possible, and explain to the patient the full and long-term effects of what has happened. The NMC promotes all healthcare workers to speak out about any concerns they have and feel supported doing so, also known as whistleblowing. It is vital for identifying risks to people's safety. They deal with many things such as concerns and complaints. They investigate allegations made against nurses and midwives and act when needed. Depending on the outcome of any investigations, the NMC has a sanctions guidance for the panel to follow. The NMC can issue cautions for 1 to 5 years, impose conditions of practice for a period of up to 3 years, suspend the nurse, midwife or nursing associate's registration for up to 1 year, or strike off the nurse, midwife or nursing associate from the register. The implications of the Code on Nursing Practice and the role of the registered nurse. The Code is the professional standards and behaviour that nurses and midwives must uphold. They are non-negotiable and can be applied in all different settings. It must be followed to be registered to practice as a nurse. It has 4 key aspects that as a nurse you should follow. These are: prioritise people. You put the interests of people using or needing nursing or midwifery services first. You make the care and safety your main concern and make sure that the dignity is preserved and the needs are recognised, assessed and responded to. You make sure that those receiving care are treated with respect, that their rights are upheld and that any discriminatory attitudes and behaviours towards those receiving care are challenged. Practice effectively. You assess, need and deliver or advise on treatment or give help without too much delay and to the best of your abilities, on the basis of the best evidence available and best practice. You communicate effectively, keeping clear and accurate records and sharing skills, knowledge and experience where appropriate. You reflect and act on any feedback you receive to improve your practice. Preserve safety. You make sure that patient and public safety is not affected. You work within the limits of your competence, exercise your professional duty of candour and raising concerns immediately whenever you come across situations that put patients or public safety at risk. You take necessary action to deal with any concerns where appropriate. Promote professionalism and trust. You uphold the reputation of your profession at all times. You should display a personal commitment to the standards of practice and behaviour set out in the code. You should be a model of integrity and leadership for others to aspire to. This should lead to trust and confidence in the profession from patients, people receiving care, other health and care professionals, and the public. If these standards are not met, the NMC will act accordingly, and in more serious cases, this can mean being removed from the register. Failure to meet these standards can mean patients' needs will not be met and can be detrimental to them. Having the code to follow is an important part of nursing for many reasons. Some of these are: reduces harm to patients, provides better care by putting the interests of the patients first, provides safer care and promotes trust. It also makes nurses more aware of the things they have done wrong and work on them. The code provides a clear message of what is expected of nurses. Nurses need to revalidate every 3 years, and when doing this, they must commit to upholding the standards set out in the code. Nurses must have their own accountability for the professional judgment and the care they provide. If a nurse feels like she cannot do her job and failures may occur through things out of her control, for example, staff shortages or not having the right or working equipment, she must raise these concerns to the correct person as soon as possible. Under Section 16 of the Code, nurses must act without delay when there is a risk to patient safety or public protection. Failure to do so puts the nurse at risk of failing to uphold the code, and consequences will be faced. It is inevitable that there will be complaints made. Nurses are expected to be fit for practice by the public as they are trusting them with their health. If for any reason they were not, many things could go wrong, and this is when complaints start to happen. There are 4 main categories that complaints fall under. Lack of competence. This is errors happening over and over. Poor standards and communication. Not correctly working as part of a team. Misconduct. Theft, verbal or physical abuse and poor care. Bad character. Any type of criminal behaviour. Ill health. Long-term health problems that are not being treated and managed. If the nurse is upholding the code, these things should not be happening, and thankfully happen less because the code is there. An explanation of the need for effective communication in a multidisciplinary healthcare setting. Communication is extremely important in all healthcare settings. To meet the best healthcare needs of the patient, multidisciplinary teams work together. They are a team of healthcare workers from different professions and that provide specific services in complex care needs of a patient. A care plan is made for the patient, and communication is a must for the best care to be delivered. Each professional on the team should know their own role and responsibility and respect others. They should all have the same goal and be working towards it. Although it is a shared responsibility to reach the goal, everyone is responsible for their own actions. Communication is a big part of the code. This is because nurses are dealing with patients and professionals all through the day and must be able to keep others informed of the patient's care so mistakes don't happen. Having communication, you will be a good listener, have good body language, be non-judgmental and be honest. You must be able to assess each situation you are in and adapt, be able to speak clearly and be understood, and meet any language barriers and support the needs of the patient. MDT is focused on a person-centred care approach. They are focused on the needs of the individual and what their preference, needs and values are, and the person is treated with respect, dignity and compassion. Compassion is the core of the NHS values, and all nurses should practice this. Compassion plays a key role in communication. Compassion gives many different positive outcomes. It can speed up recovery and prevent health problems. It helps build trust and safety through listening, understanding and responding with a caring approach. The more trust that is gained, the more the patient will have better health outcomes and willing to listen and cooperate in their care. An explanation of the need for effective communication in a multidisciplinary healthcare setting. The effectiveness of the multidisciplinary approach in a healthcare setting. The multidisciplinary approach to nursing is the positive and effective in many ways, but also it has its limitations. A multidisciplinary team is made up of different professionals. They work together to meet the needs of the individual and provide the best possible outcome of care. For a patient who has many different needs or complex care, the multidisciplinary team provides comprehensive care for each need. With all professions working together to reach the same goal, the needs of the patients are more manageable. As there are many professionals working together, the decision of which treatment is right for the patient will come from more than one person. Although the disadvantage to this is there could be some confusion or personality clashes, therefore disagreements before an agreement is made. But I still believe by doing this there will be less mistakes and better care because, as professionals from different backgrounds, they will have different expertise and have seen many different outcomes. Because there are a lot of professionals working on all areas of care needed, the patient will have more confidence. But sometimes, because there are so many, some professionals' ideas may not be heard. This could have a negative impact on a patient's care and take longer to meet their needs. Although that may be the case, the most important needs will always be dealt with first. All the professionals working together must be able to communicate well for things to work and understand their own role and what is needed from them. Without this, many things could go wrong and care needed being missed. Another good thing about having a multidisciplinary team means that patients who need to be referred for specific treatment will already have involvement with the person who deals with that, and the team can work together to get things moving faster and the necessary treatment started. In my opinion, this will give patients better chances with their health and needs. Overall, I believe having a multidisciplinary team is a real benefit to the public in need of treatment, and although there are negatives, there are positives outweigh. That's the end of my presentation. I hope you have enjoyed it and have a better understanding of the roles and responsibilities of the registered nurse. Thank you.